So when someone's in pain, they'll typically, they'll lay in the bed, or they may shift a little bit, or they try to avoid the movement that causes pain, which is a good thing. But what they end up doing sometimes is avoiding movement altogether, which is not good because our bodies thrive on movement. And I think if people knew that, they would at least try to move with help. And so that's why I love MegRelief so much. When you first shared MegRelief with me, I was so excited about it for a couple of reasons. One, when you're in the hospital, a lot of times people are dependent on medication. So they may get pain medication every 4 hours, depending on their diagnosis, or it might be that they can get it every 2 hours. Well, what if, as a physical therapist, we walk into their room, they just received their pain medicine, it's not working, we still have a list full of people to see, we need something where we can get their pain under control right away and then treat them. And so that's what MegRelief did for me. And that's what MegRelief does for people who feel like they can't move. They spray a little bit of it on, they experience relief within a couple of minutes, and then we're able to move forward so that they can move in a pain-free way.